we Dove TV and SO TV at the same time. Intino catch a winner be non cancelling you be frebusian phone na so mumfa omofidi no fan to Dove TV and I say SO TV and na ubenya your life ewo ho na me san kai will say Facebook Facebook your Dove TV GH Facebook sans na Facebook na so SO TV GH and also so ewo the same thing and Dove TV ewo SO TV no so ni na ewo YouTube and Facebook at the same time into no obetima ka che wonu e be say on woso on ko na on subscribe na afi on share links no na obia ensa enkabi say yetra konwam say dia say na mo amunim abo na onso pepepe apa ho kakra bi na time with S.O HERBAL HOSPITal na anyame nko na me wo as usual me doctor ho fe Dr. Abigail say makacho say obi omoma bia no ho fe baba bi omoma bia no ho fe intino Dr. Abigail enso so ewa habi inte emrem no yene nba twetwe nkomo na afi ye bebie phone lines na so entem na question bia wo bia efa wapomu den ene wa ho odin ho bia no wa bisa doctor na ono so ano kama edi amount dedi kan mo mefa nchia kese ema ye CEO Dr. Sophia Asi Okansi say makacho say she's beautiful outside and beautiful inside. Very beautiful outside and beautiful inside. Yenda na se na yenka se ayiko enye obi bia na obenya sika bi adwuma ama obi anya bia ye enso so no de obi bi adwuma ama ye nya bia ye si aye de SO TV enso aba be ka ho enti no ye ma no ayiko na ye ka se goodos dedi kan no said ya mamunum no ye de ye ho be se nyame nsa nyankopɔ ehwe obi bia so na de da wakoma so bia nyame enye ma wo nyame enye ma wo said be ya ube say there's God. Me de bia me ka say there is God. Say won believe bibia kra da believe say there is God. And nyankopon ofane bo a enye say on to ntem ana say oto ntem nyame ye ni bibia wonim dem ya at the appropriate time at the right time no nyankopon eho na ono odi ne djuma bia wo be wadwun say ache but ono nim adekronti a wama na che ebia ba ntem a nanka emfa sempapa emfa embra me di ne to floss anan the doubting Thomas. God will make a way where there seems to be no way. He works in ways we cannot see. He will make a way for you. He will be your guide, hold you closely to his side. With love and care for each new day, he will make a way. Nyango pombe bi kwan ma wate for ni to no so keke na yankwaje nkrato ewo S.O HERBAL HOSPITAL ho na ye ba mini doctor ye de enkoman e be hyehyɛ so adverting do man hwe bi
Masem omanfo mani yi omoya wo mo so a this was SPERM S.O HERBAL HOSPITAL yare ahoro a wo sa no omanfo ho adwiri pa
me de yare chini sa ankosi aga nanso S.O HERBAL HOSPITAL ebe mi no menya mayares
wo de ya mo nsachi Dove TV na mo hwa nwanwasem omanfo mani yi omoya wo mo so a this was SPERM antisa wo hunu hwe ko hwe kwan ofa so a o sa won yare anya kona bra o
me de na malaria fibroid typhoid fever any joint pains na ekumi hu na madamfo no ntumi hu emfie ene kwhwe wa asanyem
diabetes hepatitis B hypertension liver and kidney disorder prostate na whether stroke STDs any sisiare ho na mo kai yare bi nu a omanfo sie ni aduro no obi fan kwa S.O HERBAL so ansa kwhwe the pharmacy enduo no straight from the forest na wa akonwa ade anom na yare no betra mu a ye behwe any laboratory services na numbuo so eda form wo adwuma Monday to Sunday sikura Accra ha S.O HERBAL Hospital ewa Amasaman Stadium Junction omanfo mfre 0555-529-253 and then 0503-449-444.
We're going. Our mama kwaba bi madiba Dove TV so asanso ama wakwaba ba S.O TV so I say makacho say you both Dove TV and S.O TV live intino ye koyenum iti ana mu chinchin mo fidie na munya Dove TV amufanto munya SO TV so na modi ato because ye wonyo mapa e de mamo abrebia kam hunema Dr. Akwaba doc beautiful doctor
handsome Theophilus
I'm that's it we dey me mo Akwaba ba Dove TV so na SO TV so
mejo so
Doc, before I start you bedding kind ashe yare dodo and they beka about HIV.
Okay.
And they be station on HIV. But before that, no, share yare dodo SO HERBAL HOSPITal. Yes, sir. Na obi wa ebi ha na onfa embrana yensa na yare ten.
Okay. And say mema obi bia akwa baba Dove TV any SO TV so. Na enyumewe media sempa every S.O HERBAL HOSPITal e de abramo na oba S.O HERBAL HOSPITal ye hwe yarewa bebre bibi ti say diabetes wo diabetes ana wo diabetes wachina wonya edu ana diabetes etumi se ani enti wo obi amepacho bra S.O HERBAL HOSPITal ne beje edu obi a wo HIV wo BP hypertension hypertension na BP hepatitis liver disease prostate kidney na how and I say wusisi na ye ya odompemu na ewe o and joint pain baby touch mana de bia wuti pain mo u body ni mu and we dey mu me fa chobra S.O HERBAL HOSPITal obi a ota dwunso wo keteso ai de bia me kasa ujunso wo keteso a untumi kwa awosha ujunso okete so untimi call boarding house enu ha adwin bebre especially say oye school anase obi a obe call boarding house no ojunso okete so ahumti anase it disturbs a lot especially no it brings the child's confidence down because uko bowa ye in boarding house uko na ujunso okete so ye best enti me papa me mama se uba anase wunua bi anase wadanfo baby anase uneba bi ba ejunso wokete so me recommend S.O HERBAL HOSPITal ama uba ye be ma wedu ama junso no ajai na watumi akọ boarding house baby bia opese ukọ da no ubetumi akọ wa candidiasis anase ye friend white anase odepoa ama etietie wuyu panta ade fita bi wo ho anase ukọ baby na u ana u pass by obi na ese sister we enkoye kra me pacho mema obia entage osa bra S.O HERBAL HOSPITal ye wadu wa gonorrhea na wanu medra enko ya kacho se gonorrhea de wonya gonorrhea na onum edo na enko de enu anu no mepacho enye enu anu no na uba S.O HERBAL HOSPITal de ubenya edo de bia meka se S.O HERBAL HOSPITal ya wie bia ewo din ewo ewiase uba S.O HERBAL HOSPITal ubenya edo. Now one good thing about S.O HERBAL HOSPITal is say aha uba yemfa edro baako ensa yare 100 debi yare bia ni na edro yare bia eni na edro aha no uba yemma wo say edro we ubetumi dia ma obi o BP diabetes debi wa kokosu how me pacho bra ne beji edro wa we ni afra baako afraja baako anase utigana anase hamatan yambaye ba wo de wa start enhu snow anase eye okusukusu eni ne ye otise wisie se na titifo ye nanane mu omu soja ohun sa wisie na ya eba no uhu ne sa anase weni no uhu ade wo afa anase ade ne wo etwa uhu obi bakra unim se obi na eba unam ye o se wuto amenem me pacho S.O pen na uba ye beti weni na ma te uba one touch S.O de ebe eni a wa nkasa no o sha dance gu Dove TV na S.O TV no me pacho unya o baby a eji se S.O HERBAL HOSPITal and one good thing about S.O HERBAL HOSPITal ni se eba eni no the number of years weni na fra no we don't count it and I say it doesn't matter over S.O HERBAL HOSPITal. Dear here ni se wu obeto anamo aba na ya so weni ne so ama na edi watu edro ni so na weni na bia ma because yen nyina enim se eni no eno ani ye kanea eno ani ye bibia ya meka say ukọ baby anase ye nyina ye wo privacy a yen privacy no yen kwa na epese ekọ ho anase yen kwa na ese ye kọ ba esanse weni no wo how anase problem bi ba hu no eji se obi ekoja wo female infertility wawari ache nyinsen ebimba wachina che mepacho mema wa bemumbu de bia ya meka se ment na ho abra S.O Herbal Hospital ye wado for female infertility na ukofre obi ba se usuma no ye say wo die anase wasuma obi na ni maame na ni papa se tina baby menko wana se wadi ni yemba ni nyina mepacho mema obi enka sa asem ncho abra edro papa wo S.O Herbal Hospital bra nebeji edro wo low sperm count ya ka chew se enya ade a oni obi obehye nyinse anase enya ade a obe impregnate oba
obetuma anyim obi meba chomenti na ho na obi nka sa asem ne ncho bra S.O Herbal Hospital enti na doctor Sophia asi okanse akofa edro papa ba se woso oni oba betina na so betumi anyinse oba na wawu oba fefefe na se bema fefefe center for na opel uba S.O Herbal Hospital no ubenya edro wa sexual weakness ya de bia mekana brati wo S3 meka say wa oni oba sha wo mpem on last 1 minute na waba wo so na efe 1 minute man ana say ye fe okojo papa kwesi papa minu abema ade na obetina na obi afa okojo papa abra betumi afa sweet name sweetheart baby daddy oh darling oti wona abra breakfast in bed me pacho ubo ejuma yi a oba ni nani beso oba krokro onfa wundi agro ena enu S.O Herbal Hospital pe na obetumi anya sa edro na ebeboa wo osisi achia oh na wo kwanesi abrewa ide ni sisi no achia na efe wo wo betwema na say ya ma o back name oba ni sisi achia mfacho uba S.O Herbal Hospital ye be ma wedru osisi mu ebe ye di se chakra uba S.O Herbal Hospital ye be ma wedru we betini obi a onim obi a owo stroke me pacho mema na say wo relative bi a owo stroke wa peja na che na S.O for say wa bre na bra S.O Herbal Hospital ne beji wo stroke edo cholesterol ne how ana den ne how wa kwesi wo cholesterol ni wo sro wo yam hyehye wo say wo be wanu there bi wo to ana moba S.O Herbal Hospital me pacho hu ye be ma wedru a wankasa hu say yes ya ma wedru a body ni mu ebe ya okay de bia me ka say wa o pese wo boost your immune system enye say wo yare but o pese boost ana say kan say o pe more strength ana say o pese wo de wo say body ni mu no oba S.O Herbal Hospital ye be ma wedru okay doc pacho so podium na yen twa ye ho na yemra ye twa ye ho akogye nkrato ye ba mama wato aso na afi ye koye no pacho ye twa ye ho aba
S.O Herbal minya udeni uye boy S.O minya udeni uye boy S.O
yenya udeni uye boy S.O Herbal
yenya udeni uye boy S.O yenya udeni uye boy
I don't know when you ajisa
odo mani nye say hey said you come here wa mo sadie bi ede
unu enye kuna miku o me ma wa feel like a woman oba de say o feel like a woman nti unu oba ti amane feel like a woman S.O Herbal Hospital o sayare bia e fa no typhoid diabetes hepatitis B HIV it say o say eni weni kwa utra na weni fira abra S.O Herbal Hospital wo ho dia na e say we di ho aburo edi ebusua na aburo na de kuye no eni o na yema ya tu ni o na me be ma no wo si ni trase I see wo bi sa do so ye ba SO Herbal Hospital o ma ye ngowi ye di ko share how far no Masipiti. And I'm about any idea. All to no more who do you know. You are a yenche. And so share any Jankwana by a brabo. And I'm SO Herbal Hospital. Ain't he? Me say, bra. Say a woo say Kurana brand. I'm sorry. What it? I'm to Mama. And my mum come baby. I'm like SO Herbal Hospital. Namu beji a dowi. Namamu bemamu. And yedi na your family. Mira. And yet dada no wada. Mira. Aye.
Could you, Papa? And they die.
We have felt daddy. They say, what da? Would be. SO Herbal na. Am I already? You have another for my kwaba bioma de be Dove TV and SO TV as well. Ye kwaje nkrato kakra efi SO Herbal ho intino ye da mase munya abotre na motwen ye. Doc ye kona ka si intino ye fasi preko na ye nto aso.
Me pa choyu. And see, yes, sir, stomach ulcer.
Okay.
Obia over stomach ulcer, obia over tuberculosis, and I say any lungs related condition, and I say heart related condition, bia one. Oba S.O Herbal Hospital, ye were drama, tisu emma, or fibroid. Na you see, almost most of the time, year surgery na, some back again.
Yeah.
And so we go back for another surgery. But one good thing about S.O Herbal Hospital is uba, and your surgery na yo, a Herbal Hospital, and see a drone de bema, and see your ma drena. They say your ma 2-3 years no. Now somebody say ababim there be your ma your ma.
You two say who?
Yes.
Oh wow.
And see your ma ye bibia ma kama. Abra unko because one thing say who die adrene so na a ye kama.
Wow.
Yes. Because ye adrene obi anim say a organic. Yes, sankofa.
Pure organic.
Me sankofa na so mo kan sankofa mo wo
titi will be chire titi will be can.
Yes. And see SO Herbal Hospital there. Ye sankofa ye adrene e pure herbal ye mfremu ye. Wa oba pharmacy na wa wo hwe se na adrene de si ho no. Okombedo edro no say ye ko endo edro but uba SO Herbal Hospital kwande yes because packaging no you know when you go to the hospital we preach cleanliness and see we preach for SO Herbal Hospital we practice what we preach to the public yes say keep your environment clean so uba your environment uba your compound no everything is unique. Na SO Herbal Hospital no so ye do no unya wo baby baby nkofo fresh omo pedo ni wo pharmacy na de be ye do no ebia ni pharmacy na say SO Herbal Hospital kwa na obetumi aba abaji ye ni store bia ye di edoni koma omo mepa cho se oma obi dada o se makoji edoni wo baby ye se ye SO Herbal do mepa cho enye SO Herbal do because ye do no ye ntoma obi se frankoto debi ye hospital and to pedo na ji se oba hospital enye se oba pene de edoni ma o debi ye ni wo bon komo ehia se oba ye labs a wo ye labs and sana yama we do.
Okay.
Yes.
All right, Dr. Akani hina na meso me kaka me beta ton say SO Herbal Hospital ye wo Accra Amasaman Stadium Junction. Ho na SO Herbal Hospital ye wo wudu Amasaman Stadium Junction now dey bisa say wo pe Stadium Road. Ye show Stadium Road na for Stadium Road ne so won sa left e benkum ne so no. We bon say gas filling station bi wo tra gas filling station na we bon so abusan fefe bi ya paint no lemon green. Ho na SO Herbal Hospital. Even we hear wo no ho abehu say ye wa hyenso de ewo ho abehu say ye check obi BP obi typhoid near ye check say obehu say what do hospital yeah that's building in a TV ne so na etwagu no aha wo ho ahyenso de na make no na wo TV ne so no nti wonya do happen no say ampa wedu SO Herbal Hospital baby Dr. Sofia Asi Okansi oye no wonders no and second Jesus anointed hand no wo de bra yare bia say the doctor abobo yare no so no yare bia ewo ho bia no wo de bra SO Herbal Hospital na doctor ebeti ne te edia amount I said me catch am say and they be hear something about HIV and AIDS into no doc yes. Ma mimbisa o then na obi ya chese obenya HIV then the cause of HIV is.
Okay, before you be delay into how transmission now HIV itself is an infection.
Okay.
That attacks and affects the immune system.
Oh, okay.
Now, when we talk about the immune system, especially the white blood cells, so white blood cells are there a fighting infection, and the HIV virus a targeted, let's say powerhouse
Okay.
any immune system, and I said the white blood cells and see a targeting is that it starts breaking down the white blood cells, now a multiply, and see it takes over the white blood cells, and I say your immune system. And before and I say obi be say na HIV no me den kofa na say den ba. Yes, there were ways in which the transmission in eba.
Okay.
There were through blood, semen, and a vaginal secretion, and a breastfeeding. Now blood no mami breaking it down. Now blood no in a sense say also mo yi more no.
Yeah.
Yeah.
Baba for
especially a one more boss and
yes for no mo nam kun for
yes me say obi ejuma but then omo you more le mfa ne so omo bayi me more na sa omo sikan no e twamia they don't clean it. What do they sanitize that instrument? Omo pay fi me fie na obi su frɛ na they go again.
Yeah.
Abra maybe e mfa ne say me wo yare ni bi na adina twame na oyama until at the end of the day no they keep spreading that.
Jesus.
And now obisu obi are using needle, sharp needle.
Yeah.
E dey ato ho onim se nipa ne wo yare na na se onim yare no eno so ubetumi anya blade eya nipa bebre menim se blade ne ton e dia na se I don't know.
No, sometimes no say issue need to me see na upe blade e dey bibi utwa wani dey
yes.
na
obi to me hu blade wo form na wafa. How do you know say that blade no atwa obi a wo sa yare ni bi and say twa possibility say also benya sa yare no are very high.
Yeah.
And na obi a owo crew and I say me wo fresh cut and I also wo fresh cut. Say your body there is let me put it in this way, when there is a break in the skin and I mean so there is a break in my skin and we come into contact we exchange blood.
Yeah.
I'm not saying sweat or body touching itself. I said when there is a break in the skin, definitely you are going to get it. Oh, okay. And then the semen is true sex.
Oh, okay.
Yes. When you have unprotected sex. So when you have sex with somebody that has the virus, possibility of you getting that is very high. Especially when you don't protect yourself, the woman does, because we have the female condom and then the male condom. So if the man doesn't use the condom and you, the lady too, you don't use the condom and the man has it or the woman has it, you are going to get it.
Oh, okay.
Now, and then those who do the anal sex.
Oh, okay.
Yes. They are also at risk of getting the HIV. Now, breastfeeding, and I say mother to child transmission. Now, when a woman gets pregnant, you know, we have something we call placenta.
Yeah.
Now, the placenta, that is where exchange of blood and stuffs go into it. Now, since it is a virus, it passes through the placenta to the baby.
Okay.
So the baby can get it during the pregnancy or during birth, because when at birth, baby is exposed to the mother's blood and other body fluids.
Oh, okay.
So the baby is at risk of getting the HIV, because you know we have people that were born with it, people get it through birth, and then breastfeeding. When an HIV mother has the condition, the person breastfeed, the mother then transfer the virus to the baby.
Okay.
So those are some of the ways. And then deep kissing.
Oh.
Yes. You know we have the social kissing, when you close your mouth, like the simple kissing. That one, both of your mouth are closed, so you just yes. But then deep kissing is when each of you are biting each other's tongue, the lips, and then there is exchange of blood.
Oh, okay.
Yes.
And then that's me pesa kiss ni biahe. Now kiss the kiss here, then now to me kiss here.
The people do it. That is why I'm saying that deep kissing because the HIV, especially when there is a break in the skin. So obia maybe the gum or gum maybe they are now say mouth ulcer. Now maybe also there is a break and I say moja efu skin him etimushad sa na mu yesa deep kissing possibility say ubenya sayare no very simple.
Okay, Doc, yes. Answer na ye beko the next question no. The same ye kan ya me wo question ba ku mi ni bu ma pese me bisa. Musa na wo kan bi say sex no na tumide and so tumide ace ba. But ebisu person che say we have sex and I say mo unya intercourse no na say oba no ewete to that is the level wa wete a na say I don't know and mu from na unya ace na so ace kwa unya bia enkre. You know it's a cat abahu.
Yes, and you know that is when I said that semen can also give you, and then you know the vagina. Yeah. The tissues over there. Okay. They are very soft. They are very soft. So, and then they are also mucous memory. Me pa chomo fa cheme na me person me use simple terms but chinaya and share the basa vagina na say oba se no say lining e wo ho no the tissues are very soft. So during sex there can easily be break and bruises around that area, so possibility say you get it is very high. And you said when I was mentioning transmission mode, I mentioned the semen. Yeah. So when a man you have it, you can pass it through your semen to your partner. That is why mostly they said women are at risk of getting the HIV because we are always at the receiving end. Yeah. Yes. Yeah. Na they be and see women are at high risk of getting the HIV, especially through sex. And then those who practice the anal sex, they are also at risk of getting
anal sex. Which I say. The original hole no but on original hole
now person
artificial hole.
Yes. They are also at because those places they have mucous memory, and then the tissues are very soft the linings there are very soft. So it is easy for you to get bruises around that area. So getting that HIV is very simple.
And you say mo I share mutri say se oba na wet bebe na se o HIV kwara ne da wunya binum pacho munya very careful because anything can happen. Prevention is better than cure. Into mess up. Doc, my second question be unsa na wo kan mother and child transmission no. But my say you say sisia no bi betumenya HIV but obewo ba no na akura ni HIV. Yes.
So currently, because the country or they are advancing, we have HIV medications. So when you know initial also those days, it's hardly before you see mothers going for ANC, that is the antenatal care. But now when you go there, it's part of the test they run for you. So when you go and you detect it very early, we have medications that will put the mother on. Not just putting the medication, the woman on the medication, but advising the person to take it. So when you take it, it lowers your viral load count. Yeah. So when you give birth, at least you save your baby. But when they give you the medication, and then you decide that okay, do away their mommy, but now they are called too few. You are not helping your unborn baby. See, in those days, the rate at which mother to child transmission was at that time very high. But currently, we say a ma to my bofra, and I say a ma to baby, no, apart from because of a drone. Yes, it's a draba. And to unyim now call ANC na u midwife and I said doctor who said who was high area. Yeah, the wutu a drone so untem. Now boy before I do 9 months no. Now when we load no ide abba form. Now to me who healthy baby. Yes.
Me catch am say S.O HERBAL HOSPITal ye wo Amasaman Stadium Junction. Amasaman Stadium Junction Accra. Intino baby aye obi an oba Amasaman Stadium Junction. Wo dey offer Stadium Road ne so aba wanim kakra bi won sa left ne so. We won say ye wo gas filling station. Ultra gas filling station na. We won say some a story building for fire painting lemon green. Na S.O HERBAL HOSPITal. Doc, your topic we say I think say beto aso. Yeah, because it's very important. Mami bisa bibi so how symptoms bang any symptoms bɛn na obi ehu obi say no me yenya HIV anase menya HIV.
Okay. And see me pacho before me can asem we say obi nya symptoms are maybe bobo anase obi abeka cho say onya me pacho don't diagnose the person, let the person go to the lab because they be me can say yare no omo symptoms ni say. And see symptoms number but maybe obebe tifi on him obi obeka say nipa ni wo HIV me pacho and see be obi wo HIV onya headache. Okay. Onya fever. Okay. Chills. Weight loss, night sweat, onya rashes on the skin.
Oh, okay.
Onya diarrhea, onya dry cough.
Oh, okay.
Onya muscle pain and I say muscle ache.
Now joint ni ya.
Yes.
Okay.
Now ni muscles ni ya. Now ni hu ya sheshe. Award deno. Obe hu say onya ekro and as rashes. Awa ni body hu, ni kon hu, ni nine hu. Obi so ho omunya mouth ulcers. On say ni ha aye ekro nanu apai
kona ho no
ana omu tanya diarrhea obi a wo ho nya diarrhea but omu diarrhea no aye more frequent sometimes it lasts more than a week. It lasts years to especially
ni yem hwie
ni okay diarrhea ye obi a ni yem ahwe yes omu yem hwe ana munya dry cough. Dry cough ni wa ubo produces sputum
uba ne siu mu ba twema frems bia ma
enu ne dry cough make no na night sweat ye anajo no or sweaty bebre yes na general malaise and I say generalized body pain and I say generalized body weakness they bia wayemre yes ni ti ya ni ya award no when I take a cry, now my breath, those are the symptoms that obi be catch up say me experiencing that no. They be make say you do other tests to rule out other conditions, but HIV is also included. And then I want to plead with everybody say before obey sa test ma obi no me pacho. Don't just stand up and do that test. Always seek the patient's consent.
Oh, okay.
Before doing it, because the patient can sue you. Yes.
Now,
as much as you are trying to help the patients also have rights. So what you do it, you tell patient that okay, per the symptoms you are telling me, these are the things I'm suggesting, or these are the things I'm suspecting. So I would like to do this and this test for you.
Okay.
So patient will tell you, okay, go ahead and do it. Sometimes they tell you no, then you convince the patient, I want to help you. But if you don't help me, I won't be able to help you.
Yeah.
So give me the go-ahead and let me do this test for you. When the patient give you the go-ahead, you do the test. You assure the patient that even when it comes positive, there is medication. When it comes out negative, try and protect yourself.
Oh, okay.
Yes. And I'm person make away and my takoye pedicure na de.
Pedicure ni manicure ni dadicure.
We are at risk because obekono especially omo treatment no sa de kitikita no mo de yin to me twa yes also omo ko saluma omo wo ba obi wo ho obe hu different types obi ba wo ye mani we also mempe instead of say madam ne be discard no or the betumu
obeto atwe no
onto atwe or the betumu enti obi be ba treatment no say me de miniska fa sa den fa de wo bo ni mu de e den fa ye mame enti say atwa obi a wo sa yare ni bi na ekotwa wo so a you get
na so obetuma is stingy ana pepe na wakwa konya yare ni bi.
The day I went to the salon I was going to face my nails meteor and lady be buy and so so on to trimmer or see there be oniska na use the obo ni mu in fact meteor no menim na me pese me catch and say ubedi 2 series echi akonya yare but then onim nkofo bi o koka and see me team no I was sitting there no na me buefu me mu say because of 2 CDs and also unused because our body mo different colors and to me say me kwa koto treatment na madam no be here or you box in a trim say she's removing it because me do all you 2 before me do a menje Whether it's new or not, say my family, my naked eyes, who say who see freeway anymore. There is no way I'll take it.
Oh, okay.
And now, member so I'm barbering shop.
Yeah.
Obi why use blade etuho. And I say machine.
Machine, no, yeah.
I try obi. Also maybe more doors bebre. On people on this time or the baby people home. And see or the on say now I take cotton kakrana or their clinic. Now I am and it to be good there. Someone said they be cancer it's your health though. So when you spend money to protect your health, over to me at machine be. And anytime I call barbering shop no, now the why they call.
Yeah.
You won't call from call barbering shop, even comb, omo comb call.
Yeah.
Obia omo crown tomu blade pack.
Yeah.
I say omo bag. And ti bibia wo ma because unim nipa kra omo yi ne timana ansana we the buy. Unim nipa ni HIV status. Unim how the barber na say hairdresser no taking care of the sharp instruments. In fact, we are all at risk, especially we that like going to the salon to fix the nails, to do a whole lot of things, and then member call barbering shop now, they know we are at risk.
Remember your barbering shop near that we are at risk. Me krama me enhu bomb me na me ko yibi tia my fine boy. You say yeah boys no. Boys na ti say yeah the barbering shop e say yeah fine boy. Na me ko pe fine boy na masan ko fire the amame ho dog yeah answer na ye be phone lines and then me sure say na be your testimony
okay
but say you will be ye be but answer na ye be call that side no mama bi say HIV and AIDS difference wo and what is the difference
and see AIDS no the advanced form of HIV.
Oh, okay.
Yes and obia owo AIDS no.
There's what graduate.
Well, it's said they were graduate. Say one move and the mechanic say from class 1 what do form 3.
Wow.
So over call
verse.
And see mostly no obi awo HIV. Now under a droso. Wa orthodox medication you don't take.
No.
The herbal one you don't take.
No.
And see wo there ya catch you ba pese obenu medo bia no. And see as the years goes by no the viral load and as a viruses no it keeps multiplying and see about break your immune system no about take it over your white blood cells and see me pacho mo pardon me wet and baba use and see wo body no and as a system ne baba to say gatem and as a baller so I am so weak there is no protection or and as a body ne end to me defending
immune system na weak totally
and I say I break it down and to me defending
sickness
be and we have we call opportunistic infections. Now and we say ma yare bia e kwan say otumenya bibi ti say tuberculosis otumenya a whole lot of conditions. So I say body need there bibia to me comment am say I to say baller so because baller they ask
yes. Okay
and I saw omunya yeast infection yeast no omunya or vagina omugusunya or mouth as say especially obia or advancing some patches they be say nenum aye white and omusanya oral trash. Some white me person may describe how it is. Some white be
na say na funo
nenum so white sa oral trash
I so be ada sorry na
and omusanya oral ulcers and yes very way out to me and omu diarrhea no and I say yam hwe no it's very serious
okay
and then it lasts for long. Ooh. And see, no, for a whole month, 2 months in ano, on any.
Woo!
Yes, no.
That is Obia what graduated do AIDS
no. And so onu ni pasa no to say Obia wanya HIV maybe need a bell last to say 10 days and I say 5 days no. Onu ni then very severe and then it lasts for long.
Okay.
What I say? And almost soon fever no lasting for more than 10 days.
Wow.
Yes. And to my friend say obi a HIV no. Maybe need their last fever no on and off. Maybe to remember within 3 days no.
Wow.
Na aja but omo de no last for a very long time and excessive weight loss. Yes. Ono the weight loss na nkasa like say ni sunu ati
drastically.
Yes. And cough no so last and it's very severe. And no they have it affects the eye. So yes, they have change in their vision. Now, omonya bibi a friend tosoplasmosis.
Then
Tosoplasmosis. Plasmosis.
Oh, okay.
Yes. Oh, say ya no edidimo. So it moves to the brain. And then there is change in their behavior and then their balance.
Oh, okay.
Yes. And now mutanya convulsion. Me patro eno mean to me kan wo twemu.
Convulsion to say akola esoro atiegu ne so.
And now say seizure. Wo ho na ni
Oshiva.
There be minim how I will explain it for them to understand.
Oh, okay.
But I say na akola esoro aka
no.
Akola no. That is how those with the tosoplasmosis or at the A stage no behavior.
Oh, okay.
So these are the difference. And the ACE no yemfa is a end stage. And I say advanced stage of the disease condition. Yes. And see a bunny treatment now obi ebrewo sa condition I say obi presenting with symptoms like that.
Pacho answer ne be treatment no. Me pacho mumfa viral load no. Their nurse na double so no fan na sanfa after 3 after and before and after no mo fan to screen so mami na mpese mbisa mmane nda so mami why me srem na fe ye treatment no.
Okay.
Dog treatment
Me pacho before I be do treatment no there was test mienu bi ayeye.
Okay.
Now your friend bibi first respond. First respond is waba what count with symptoms naturally. And to remember what collab akoye.
Okay.
And to first respond we better say you are positive.
Oh, okay.
Now, and now we are positive ninkwan. We need to confirm because cell lab they work with a lot of blood. And mostly it's advisable to always confirm your positive first diagnosis.
Oh, okay.
First respond. It's always advisable to do that. Now, after that, we have something called oral quick. The oral quick is also another way to confirm that truly the person have that. Now, this is where we come to the viral load.
Yeah.
The viral load is an important part of your treatment, especially at S.O Herbal Hospital.
Okay.
Now, before we put you on the medication, we want to know the quantity of viruses or the HIV virus you have in your blood.
Okay.
Before we put you on the medication. Yes, this is what we do at S.O Herbal. That is what I'm talking about.
Okay.
So at S.O Herbal, when you come, before we tell you that this is the medication for HIV, go and take it. We need what we call viral load.
Oh, okay.
Yes. So you do the viral load for us to see the number of viruses that you have in your blood before we put you on the medication.
Okay, for instance, doctor, you hear your screen so the other screen is so no.
She says a watch screen so no. This is a young lady waba. But then waba can say wo yare my test are confirming.
Yeah.
Now I want to know the number of viruses you have in your blood before I put you on the medication.
Oh, okay.
So, you know, if you see your screen, we have before and after. Now, before ni say waba.
Dr. Mpacho, so put your mommy announce phone lines no. Na ye din komo hina no metumi afre na ye de afrem. Mpacho ye phone lines no. Na mebe buba mamo no said be ya obefre na question bia wo bia no wetumi ebisa doctor if you say doctor e wa ha wunti na doctor wa ha me meka say wapomuden ne wa hoodin enti na de bia ye betena ha said be ya obenya hoodin dia nanti. Telephone number no ye 0532 509920 0532 509920 and I say 0532 504600 0532 504600 mpacho frɛ baby awo bia so wa tebubu wo Ghana ha bia se uni Ghana kwa na wo outside Ghana mpacho frɛ doctor wa question bia bisa doctor na doctor ebeyi wa no doctor
enti
mpacho mfangu screen ne so mami why misremu
so those are enu na ye friend viral load no
okay
enti I wish we can get it so that yes we benya then explanation on betima say so we have before and after. Now before they say ye do betu edro so yes we have viral load no. Now over S.O Herbal Hospital, if you don't have this, there is no treatment for you. Okay. Yes. And see viral load no, this is a viral load of a patient.
Okay.
Now ye do so then after 3 months you go back and repeat that same thing. Sometimes it's advisable you do it at one place.
Yeah, okay.
Your funny say makoye wo lab A.
Yeah.
After 3 months, you still have to go to lab A to go and do it for us to see that after the 3 months, this is your count. And I'll be saying one thing that always I tell my patient that I'll take a copy and I will give you a copy. Yeah. Do you know why?
Okay.
So that patient don't go and come back and tell me that, Doctor, you've massaged my fingers. The figures.
Figures, no.
Yes.
See, we have some figures, no.
And I said, what say there be? And on say, Rebecca say, Obi or Chantron, say, I dance any or takrado or so tamale. So I take a copy. Now my mouth so copy.
Okay.
And after 3 months, who koye bar. Now we first copy no. While be you with them suma immediate.
Okay.
Then I na my bobo figures no before and after no. Na me dey show.
Doc, what the insama ye kahina onim dia ama mabohu. Gawo fo no. Ene sa kwan fo na omonam no ye beden ye bibi to stop them and I say ya ye bibi awareness be for people to
and I one before me can ye be call no.
Gawo fo no okay.
Me pa cho obinya saya na HIV no me pa cho. And you said the person is unfaithful to his or her partner.
Okay.
Because medical can say it is not only through sex no. Because say our society obinya saya no they forget about the other means
almost sex.
The only thing that comes to their mind is this woman no onye faithful to the partner. And I said this man is not faithful. One day now because say and now ye can patients be BBC ward and I bon komo. And I'll say we doctor ni and I say nurse ni and lab ni or by mistake panya be wo onya saya arena. The umbeka say this is for no drama. They forget that you are at high risk because you are dealing with blood every day. Emergency comes, but sometimes emergency comes you forget about yourself. Ooh. Because you want to save life. Yeah. You forget to put on gloves because the situation in which the person comes in is an emergency. You need to save that person.
An accident is
that is why you are trained to do. And I watched a video when a midwife was on a bus. And then there was a pregnant woman in labor. But I'm telling you, if you're in the health system and I say you are a health professional, you are in a car, somebody is sick or then somebody needs your help, you forget you don't have any protective gloves or anything to protect yourself. You want to save that person.
Yeah, that's your job.
So when the person did on social media, they were bashing you are a nurse, you are supposed to, a midwife, you are supposed to know better. On the bus, I think the bus was coming all the way from Tamale or where. Where do you get the gloves from? Because maybe fruka and I said they be an uko baby no. Uti kemusa adwene about when never tina kama say and they can make way major accident victims were can mami share gloves.
Doc, mami say mpacho sorry. Mami say phone numbers no and to jabi. Mpacho telephone numbers na be to my friend and Dr. Akasano. 0532 50 9920 0532 50 9920 ana 0532 504600 0532 504600 mpacho frɛ na ebi ananya okra na wo yare na wo nua bi wadamfo bi obusuani bi anase wo de obi oyare bia no save obi life one ne nkasa crowd save ne life na benya reward from God. Thank you very much. Let's go.
Now go for now come. It has to be a collective work.
Yeah.
It's not going to be like one person's ejuma.
That's go for.
Yes.
Okay.
Ejuma.
Yeah.
Now, the Ministry of Health have to come in.
Okay.
Then our community leaders or our chiefs.
Pacho, so podium, menya call. Yeah, hello.
Hello.
Good evening.
Good evening.
Pacho, we didn't maybe our frefi.
Never said me sister me free Pashaman.
Pacho give to you.
And my sister Obi also. Now the same time no sound liver problem and no buy anything.
But also Obi what day?
So also. No sound liver problem one.
Okay.
Yes, Slavia one to give out.
Okay.
Fatty liver.
Pacho, o de fato so doctor ebe you ano.
Okay.
Pacho you.
Okay. And see, ulcer is a different thing. And now, fatty liver, no. The oka says, no.
Yeah.
Fatty liver. And so, and also a different thing. And see, oba S.O Herbal Hospital, yeah, we do for ulcer. And see, be man ulcer, no. And now the one for the fatty liver, no. So, yeah, be man no so. And see, who of fatty liver, it doesn't prevent you from getting treatment for the ulcer.
Oh, okay.
Yes. And see, yeah, be man do, but for the different condition. And see, yeah, can say. For ulcer then no treat fatty acid and I say for fatty liver no edro no treat ulcer. It's two different conditions and see nipa two different medication.
Mpacho said what the real doctor can in some mpacho into to America to anamon na bra S.O Herbal Hospital na oba Dr. Besho na why any na the amount why okay.
So as I was saying,
yeah.
So it is a collective work. The Ministry of Health have to come in. Our chiefs, our opinion leaders, and then the individuals in the community. So more education has to be given.
Okay.
We need to, and I say yeah, education. What you mean then?
Yeah, you born deru.
Yes, say you born deru. Now you 2 year community for. Efo says sanyamano enye. Umore for buy your own blade, new blade. Now one can say there where you umore. And I say uko supermarket utumi konya pedicure set. You was set for fair okay. Where you get your nail cutter.
Yeah, very portable.
Yes, your nail cutter, the trimmer, file, unya blade to umu. And say you would ye. Upesa will use it, then you use it. But pan say, won't na se men kwana makojina market say, sa dene enyeno. But you it unkofono NC. And to say Ministry of Health comes in. Woo society no, we all comes together plus our opinion leaders or our chiefs.
Yeah. I'm
telling you, when they come to you and I sack them, they come to you and you sack them. They go to somebody and the person sack. Nobody will ask them to pack and leave.
Yeah.
They will stop. But omuba me wana mi se menye. Omuba ho we ya. They still get.
But ebi musuka se doctor. Omu no mu ya no fine pa. Minim so omu ko hu school ni jail ho so omu ba.
And now make us say it's laziness. Say o feel say oh umore no eyedin. Enti bebre na ka say o memory ni de more eyedin. Enti omu no omu wo bibi omu di gusu. So you now want insurance.
Okay.
Insurance for some time. Then you get your blade or your nail cutter, get your trimmer, get your the file. When you take time, who do you see ubusu say me person me yem memory and nenye because I'm scared of or I don't want to get this. But me patch ube follow and I say ube di say memory and me person enye fe na ukonya yare.
Debbie Doctor me ba ma misan phone lines into antu job mu na omuntumi emfre na 0532 509920 0532 509920 or 0532 504600 0532 4600 mpacha omo fe na ye ni komo doctor wa ha na dia pese obisa ne bia no.
So it's a collective work.
Yeah.
And I'm just praying that one day we wake up and all this gao for will stop doing all this.
Do you think say health service no they are not doing good service to Ghanaians by leaving those people around because more so protected. It is a one protected. Na so nipa ko no so te wa. I say you see ignorance is not an excuse. It is a way Jan so on nam ho. Send your no so friend. Why don't them prevent them?
As I said that it's a collective work.
Yeah.
Ghana Health Service or the health system, they are doing their best.
Okay.
When you go to communities, they are educating. Now, what I'm trying to say is that me and funny so my bami ho.
Yeah.
Mama was a chance no. Omo call ho ma was a chance now. They know say me man penny obi be penny. And the funny say Amasaman. Uba Amasaman na ye nyina ye wa Amasaman yes sa Moriana mu yi no. Ye nyiru. Do you think they will stay?
No.
They will go. Because Ghana Health Service can't come to your house and tell you that don't do it.
Yeah.
They are doing their advocates, they are educating that this and this being the condition. So don't do it. As we are sitting here discussing this, somebody is watching. But all tears is no or tremor be friend is on be man.
Obuka say we dey mutu na mo kan dey em dey.
Obi beka say oh sa yare no it's not true. But yeah, you hospital no. We see people every day.
Pacho, yes, will be about my human doc. Yeah, hello.
Hello, good evening.
Good evening, Pacho. We didn't be our free.
Me did your fault.
And Pacho, who share Dover now say who share SOTV?
We share SOTV.
Oh, good one there. Okay, Pacho, yet you.
No, me say me share dog say. The HIV no, or to me someone a copper na say me anything.
Okay.
Okay, doc.
So person bisa say.
Obisa say yetumi etu ase HIV na say ana say yesosro no.
Yesosro. Me say S.O HERBAL HOSPITal yesosro bibia o.
Okay.
Yetu ase yem packing bag and baggages man call.
Oh, okay.
Yes, uba S.O HERBAL HOSPITal yetu ase ama.
Oh, okay.
And there is no way ebema we do so we the ma we na ba from keke ana say we the my mother we end do stage bia end to me affect me pacho there be uba na e di wutu edro ne so and na dey bia make say estro say e di watu edro
pacho another caller I'll get back to you doc. Yeah, hello.
Your call has been put on hold.
Oh, okay.
And estro say waba me di watu edro so it's a different thing. But on say one thing I make say hospital no eso no ba ye ma we edro no. But it all depends on you.
Okay.
They be no doctor ka say doctor so far say o ka say ye ma we do na o di ko tu fie na adani busum wo suma
o dey good here
and ya oba eso farmer wo edro se konum na wo yare no asento na wo de do na koto and I say me tie me o mama say edro we kaka na menum or I say rashes ni bia begu mama say kakra no it won't help
doc Pacho, sorry. Hello.
Hello, Pastor. Good evening.
Good evening, no baby. I will free fee and I would do.
I'm free back to it. Personality transfer. Obi, I want to do so. Any Obi, I'm not starting in the intention. Bet me up one.
Now, but I will hear Dove TV and I say, I will hear SOTV.
Yeah, be make sure SO.
Oh, SOTV. Oh, okay. All right. Thank you, doc. Pacho, you know,
yeah, or say kidney stone,
yeah.
Any numbness,
yeah.
And no na mo kan anase no. Me pacho ba ye be born pa. Ye be born ye wo edro wo ho for kidney stones. And now for numbness no so ye wo edro wo ho. And now numbness no it's they be make us say ye wo a BP so or BP some of the complication the last time ye kan say ye wo numbness. Obi a what diabetes so ye wo numbness so enti ba nya say who can numbness pena yama we do we look at all those things no then I am appropriate medication and nipa no or kidney stones no umbra with the numbness no ye be man edura sa de no baby on simple na drinka emba so that so wanya sa ya really pen
me san ka chem say ye be san ko ye nko viral road no and me bisa de bi ho but before that no me san ka chem say S.O HERBAL HOSPITal yendro no pure organic pure organic eye tetifo de ni bi ntine ye friend sankofa edro no ye testill na ye ya recre how na ya apply the right medicine no enti yare no etu ase mpacho hello yeah, good evening. Wudi ni baby how frefi mpacho okay. But you head over now say we share SOTV.
I'm head.
We head over. Good one. Mpacho yetie o.
I'm wait there. You can't say. I walk out.
But your position who ye yente wo kasa no gina baby ye mame why you listen on doc but sorry
see na
you see you be cover but na me catch from say yendro no e pure organic into your friend sankofa won tete no ye maame ne ye papa nom no ene ye nananom omo noa eduro no wokukuom na esifie ni ho nti no obia besa bia no manopa na wasa bia no manyumre yes e friend dido hello yeah, good evening.
Good evening.
Mpacho wudi ni baby awu frefi oh okay anoche Mr. Anoche mpacho wo hwe Dova na say wo hwe eye SOTV
TV.
Mpacho low volume no why my volume no kasa no nkofom kra na yen kasa na mente wonka
Ekofom.
Okay, mpacho kasa na mitie o.
But you do sirawa.
Intino me so ye do no esanko for said America no an ye no na ya kire said ya yesi wa na abenu awade ye no ansi ha na ya kasa di bibia frem da bi wa ye de mawo na wankasa wakono awade unu ya package no nicely ewo eye container mu ntie de mawa na doctor kire kwan a obefa so a obenu na kwan a obefa so a obenum na ye de mawa mesrew num na tu ase mundi instructions ne so Ghana for sa de na kaye ho ye de dro ma ye no ba ku mienu na ya package ba bi hu sa ho de ba enu entu yare na se doctor nim se onu ba ku mienu a obeti apo but o se num na entu ase so ye tu yare na se enti na ye frɛ no sankofa the organic. All right doc yeah viral load mpacho mfa ya time no yamre na ya ba mfa doc I don't say I'm saying besem bisa bibi won.
Okay.
Won say call bibi say say HIV no ye tu ase ana say ye sorosoro no. Ye tu ase HIV ye tu ase. Obi de na da so no. One first one ye di eyi na say 20,637. That is a viral load no. Emwa na na ewo ni mojanim na ama wonya HIV no. En na ye kan say viral load no. But after say didn't do treatment so no. Mo the other side no so akoba 6,902 from 20,000 to 6,000. That show and what treatment
this is just a 3-month thing.
Just
or
3
that's
months.
So for 3 months new. And they be make her say okay, it's understandable say a lot of people doubt it.
Yeah.
But this is just 3 months.
Okay.
And na enyo obi aso na enya high viral load say ebi
okay.
There are ones we have a lot of when the viral load they are bebre ebi they are not much and see 1 2 who they need to so we have viral load omaba patients omaba ya clear omo and viral load no eda at the right time no we are putting things in place so that they've agreed to come and testify. Say we have doubting Thomas around a lot of them,
like me,
like yourself.
Yep.
And see, we are putting 1 or 2 things together so that you see some of them in person. They will give their testimony themselves.
No, wait, doc. Mami, bisa sembako. Inti we unsa na ukase ebi mo ha omo viral load no endorse papa.
Yeah.
Which means when na need na ko 20,000 no. Otna ho che. Ana say what cause it?
Okay, one thing is say they be make cancer and you obia ene experience and I say show symptoms of yare.
Okay.
Obi wo ho a onim.
But you not the rap mama.
Okay, obi wo ho a onim se owo sa yare no.
Okay.
And see ebi wo ho so oba for general screening.
Okay.
And I say okoyi moja ma obi. E na ya on say ukoyi moja. And that's how we moja na di ma obi o they screen a whole lot of things. Okay. And it may be true that no and then when I say this free screening na ye no nipa ni koye na ye ma no and na onya and I say one partner anya and I say bring your partner and onu so koye screening na wanya and say say nipa no or onya na one bantem ebi o they don't show any symptoms.
Oh, okay.
Yes, and now they be make us obi or HIV. You ensure born in mama so. Obi or the person is very healthy, but or yare no. Ube check here the viral load will be much. And now the more year we edit na viruses no na multiply. So it's able to defend the virus is able to I say we white blood cell this one multiply.
Oh, okay.
And see the more multiply now will count no cause so and say nipa no or nim and one bantem and answer maybe the person doesn't know the person is not showing any symptoms of that area. Maybe it's true free health screening way Ghana for free health screening or na omunya na say bibi na crossing the path and on when na dey be ka say checking sanyamano. It should be things you should be checking frequently, especially when who say who the blade in the won't be that obey you should be blade go for the best friend when them say barbering shop no ukwa de bia onya cat machine de bia twa when them say ukoye wo mori no de bia onya cat uso a won't instrument new one no even any side to every day no and I say every month every 3 months no it will be very good say obeba S.O Herbal Hospital no na ya screening na ya ma wedro because your screening na we positive we have correct medication correct na your cholesterol capital letter
wow
medication e be ma and one good thing is almost starting medication my goodness so no looking good I'm looking fine.
The way doctor come my
more than
I'm imagining say when your favorite food is when
oh say me more at time no ye tan how omoba
okay
and nipa ne da edro so sometimes 1 week 2 weeks uhu nipa na se nipa na catch so ana say uhu ni le self say uhu na bonte ana OPD you know recognize the person till say wa ba ho consultation mo start say e bon komo no ehun na obehu say eh ene me nipa we edro no asesa na mefa akonya aka say doctor so far as you can say nyame sure ni papa say wanya sa edro no e di aba because now utie news figures no e cost papa and say utie mi na unimobi ana say wadamfo bi ana say enya wupo me pa chop good news we spread catch on say S.O Herbal Hospital omu HIV edroni bi papa ni bi organic one omu bra na omu beji edrono.
Thank you very much doctor and said you kind and one no mumbra S.O Herbal Hospital yare bia and they treat it but in person catch say yare bia e how bia no se nya wo na ye wo nua bi obusuani bi ma me bi papa bi kura na misrel tutumrika na fa ne bra S.O Herbal Hospital na baba beto second Jesus e wa ha Dr. Sophia Asi Okansi I a very me de bia meka me say nyankopon achede no owo bia ne de doctor so de ode man no say onfa haban fansa yare because Bible no crack so ye ndie duaba no na enfa haban ensa ye ho yare e na de bia meka me so bi benya wa semfi yare a na efri ohia if say yare ya e na ohia so ya aha na medro me curtains no na me de nchia kese e koma gradisa tipo Belgium na me queen so UK na me nchia me angasa me sister me di nachi ai Stella Azikwenu ai nyame ehira no kese na waba Ghana hu sem si ye wayie nti eyie no next week na ye no minim say wo wantumi amba bi ade wo mpaibo any no ebe time achi se de be ya metumi akwakoye eyie na kata me na echi me na waye bia ma me pa nti no Momo me na mingo katanachi kama e won pai bom ni bibia. Mintina usum mfidie ya tutuo. Now before na ebe kon ma hospital numbers no emfangu screen so emfa mamu 0555 529253 0555 529253 or 0503 4494 and another 44 0503 4494 another 44 or 0272 859115 0272 859115 and your doctors ne numbers nam de gusu ama no nti be pa chew free doctor no yare bia ha obi na question bia opese obi se bia no bisa doctor na doctor edbema osu Mr. Osu michiao pa nyamenka won mat konta michiao pa ni bi mintina osu mumfidie ya tutuo mintina wona mabosum su ya jayo mitua memfa fom menenam soro nkron mesi esontina wona mundro su ya jayo esontina wona mabosum su ya jayo eso si wotu a wonfa fom onenam soro nkron makra obi bia nyankopon hire obi bia no nya wakoma so adema. We love you so much. Thank you. Bye bye.